All right, today we're going to unpack a really powerful story. It's a story of incredible progress that's suddenly colliding with an unprecedented threat. We're looking at public health in Africa, all the massive gains that have been made, the huge challenges that now risk undoing it all, and most importantly, the new playbook that's being written to secure a healthier future. Okay, let's dive right in.
First things first, to really get a handle on the stakes here, you have to understand the scale we're talking about. Africa is home to 14% of the entire world's population. That's more than 1.1 billion people. But, it's not just about the numbers today. It's about where things are headed.
Because the population here, it's growing 3 times faster than the global average. That fact alone makes strengthening the continent's health systems not just some regional priority, but a true global necessity. Seriously, what happens here is going to have ripple effects absolutely everywhere.
Now, before we get into the challenges, it's so important to talk about the incredible progress that's been made. Because since 2015, the story of public health in Africa has been one of major victories.
I mean, the progress has been truly remarkable. Just look at this timeline. In 2018, you have Kenya completely eliminating the awful guinea worm disease. 2 years later, a huge historic moment. The entire African region is declared free of wild polio. Then you see these amazing strides against TB. And in 2022, Togo managed to eliminate 4 neglected tropical diseases all at once. You have to remember, these aren't just numbers on a slide. They represent millions of lives changed for the better.
And this chart right here, it shows one of the biggest success stories of all. Between 2010 and 2021, new HIV infections dropped by a staggering 44%. That's the result of decades of focused, coordinated effort. The momentum was real, it was powerful, but then a perfect storm started to gather on the horizon.
And this, right here, is the turning point in our story. All of that amazing, hard-won progress is now under a very serious threat. It's facing this convergence of crises that could literally unwind years and years of dedication and hard work.
So what is this perfect storm? Well, it's a nasty combination of things. You've got climate change messing with food and health security, the huge lingering after effects of the COVID-19 pandemic, a rising tide of non-communicable diseases like diabetes, and the constant looming threat of new explosive outbreaks. The pandemic's impact on health services was, well, it was just devastating. In 2020 alone, a shocking 92% of countries around the world reported that their essential care was disrupted. This wasn't a minor bump in the road, this was a near total system shock.
And here's where it gets really personal, the human cost of that disruption. Nearly 23 million children missed out on basic life-saving shots. This created a massive vulnerability gap, leaving a whole generation of kids unprotected and raising the fear of diseases we thought we had under control. But, these threats have also taught us some incredibly crucial lessons. In response, the WHO's Regional Office for Africa realized that the old way of doing things just wasn't going to cut it anymore. It was time for a fundamental change in strategy, a big shift from simply responding to crises to actively building resilience. The engine that's driving this big change is a unit called the UCN cluster. It was put together in 2019, and its mission is basically to break down all the old silos. So instead of fighting diseases one by one, it pulls all those programs together with one single overarching goal: strengthen the entire health system from the ground up.
And the guiding idea, the philosophy behind this whole new approach, is a model they're calling the capacity triangle. Think of it as a blueprint for creating health systems that don't just react to threats, but are actually built to withstand them from the get-go.
So, how does it actually work? Well, picture the triangle as having 3 key sides: strong governance, skilled people, and smart data. The model is really an action plan, and it's built on 4 special initiatives. Each one is designed to reinforce these sides and build capacity that's going to last.
These 4 pillars are what the entire strategy stands on. First, you've got SIGO, which is all about building stronger leadership and smarter policies. Second is SICA, which focuses on developing a really deep bench of local experts. Third, PPH4 Africa, which uses cutting-edge data to get ahead of health threats. And finally, RIP-FI, which is all about fueling homegrown research and innovation. Now, what's really brilliant here is how these pillars directly fight back against that perfect storm we talked about. Better governance through SIGO helps countries handle climate-related health problems and spend their money more effectively.
By building up local expertise, SICA makes sure there are enough healthcare workers to handle that rising tide of non-communicable diseases. PPH for Africa uses predictive models to spot the next potential outbreak before it explodes. And RIFI empowers local scientists to develop the exact tools and vaccines needed for their own communities. It's a complete, holistic solution for a really complex problem.
So what does this all add up to? Well, this isn't just about getting back on track to meet some 2030 goals. No, this is about fundamentally changing the entire approach to health security. It's about taking all those hard lessons from Ebola and COVID-19 and using them to prepare for whatever comes next.
This quote from the WHO just captures that shift in mindset perfectly. It's about moving way beyond just firefighting individual diseases. The new goal is to use the lessons from past crises to build a system that's strong enough to handle the entire burden of disease, all of it, all at once.
And that brings us to the big, critical question at the end of all this. By focusing on building local capacity, strengthening systems, and using data intelligently, this strategy aims to create resilience right at the source. And it really makes you wonder, could this new playbook for Africa, could it actually be the blueprint that the entire world needs to prevent the next global pandemic?